All right, so we will go ahead and kick things off officially. Again, welcome to all of you to this second in the webinar series on resettlement strategies. And today our topic is going to be building local resilience for resettlement infrastructure. And just to kind of reiterate some of the housekeeping practices that we went over last week, as you're doing now with the chat feature, use that area for any not only technical help if you might need with the platform, but also if you have any content related questions. Again, we're going to have a great, robust conversation here today. And so we invite you to enter your comments and questions as the presentation is going on. We're going to do our best to keep engagement going, and we're going to devote some time at the end specifically for Q&A. So if we don't get to your question right away, just know we're queuing it up and we're going to do our best to get to it at the end there. And then also, like last week, this is being recorded. So you'll receive a follow-up email probably in the next couple of days. It's going to have the link to the recording. I'm also going to include the link to last week's recording in case you did not register for that one and would like to also revisit that information. So a lot coming post-event as well. All right, so in order to kick things off, I want to turn it over to our speakers today, but just quickly introduce them to you. Very happy again to be joined by our two speakers joining us from Boston University, Heba Gowayed, who is the Moorman-Simon Assistant Professor, again with Boston University, and Jake Watson, who is the Ph.D. Candidate. Actually, he has his PhD now in sociology, also with Boston University. Congrats, Jake. Good job. Again, we're very excited to have both of them joining. They will also be introducing you to a couple of special guests that will be joining us a little later on. Very excited about that. But again, we want to get things started. So I'm going to go ahead and turn it over to Heba to start the presentation.
And thank you for that warm introduction, Anthony. And we are so excited to be here. Can everybody see my screen okay? Great. And yes, it's now Dr. Watson. We're very proud of that. So congrats, Jake. So I wanted to give you sort of, for those of you who didn't join us last time, just a brief overview of what we talked about last time. So we talked about sort of global experiences of resettlement. I talked about my comparative work that compares the United States, Canada, and Germany. We talked about different kinds of resettlement systems in the United States, and specifically we focused on Pittsburgh, Pennsylvania, and Atlanta, Georgia. And as Anthony said, you know, the recording for that is available, and he will send that out. And then today we're building on what we've spoken about, and we're talking about, you know, how agencies have dealt with the chronic underfunding that we talked about on day one, but B, also the declines in funding, the unique declines in funding that we saw over the last couple of fiscal years. And we're going to learn from, you know, our guests about what are the practices that that they have done as resettlement agencies. But we're also going to talk about a national study that Jake and I did that looked at sort of how people have responded to this crisis and to these funding shortages. And what Jake and I did is we did a national study of resettlement strategies. And our research question for this was a research question that a lot of you guys posed actually in the questions when Anthony sent me the list of participants, which is, you know, in the context of chronic underfunding and particularly the Trump era cuts, how have resettlement agencies responded, right? How have they responded to the stress that they have uniquely faced? And what we did is we contacted every resettlement agency in the United States, used the lists on RAPSNet to do so, and about 38 responded to us and agreed to participate. And our methodology was using qualitative interviews, which means we spoke to people, obviously on Zoom, because we did this over the last summer. And what we did is we asked, you know, tell us about your organization, tell us about your goal of your organization when it comes to refugees, tell us about the services you've offered. And then, you know, describe to me what resettlement looks like in general for somebody who comes to your agency. And then we asked, how has this work changed over the last several years? And could you describe how, at an organizational level, you've responded to these changes? And we found, and to foreshadow a little bit of what Jake's going to be talking about, that resettlement agencies really had to diversify their strategies to remain afloat in the context of this really, really strenuous period. But first, I want to describe sort of the quantitative aspect of our work, which is that we did, using publicly available data, some analysis of sort of what the resettlement infrastructure looks like. And when we talk about a gap, or when we talk about the stress on agencies, what that actually looks like. Now, as you all on this call know, resettlement is orchestrated, or, we could think about it as sort of a tripartite process. There's macro level funding that comes from the federal level, as well as block grants at the state level, right? So this is stuff like your welcome money, your TANF, or your RCA, depending on the state. And then things like match grant, right, which exists among some, but not all resettlement agencies. Then at the meso level is the resettlement agency, which is actually tasked with resettlement and placement, as well as other services, right, in order to manage the work of resettlement at, that the federal government sort of commits to. And then at the micro level, there's the resettled person, who we expect to be sort of self-sufficient, right? Or the federal goal for the resettled person is self-sufficiency, and therefore the resettled person is expected to sort of enter the labor market and begin to participate in their resettlement already within the first, 3 to 6 months after their arrival. But what we found is that, using federal estimates, right, using living wage estimates that are actually at the local level, and then looking at whether somebody receives TANF or RCA, looking at SNAP and other benefits, and looking at the welcome money, we were able to see that even when we consider all this sort of federal assistance, and we consider sort of the gap between what the federal government is offering and what the actual living wage is, or what it costs to live, and this is an estimate for a family of 3. And we use the MIT living wage calculator to determine living wage. So that's things like what it costs to pay rent, what it costs for food, what it costs for childcare, what it costs for the very basic things. So it doesn't even account for leisure or anything else. We found that there's about a $60K gap, right? There's a substantial gap in what we estimate that an individual needs and what is actually offered through these federal services. And as we know, when resettled individuals come in the early period, they're earning, a poverty wage, they're not earning a living wage. And so therefore, there's a substantial gap that the resettlement agency, even outside of the Trump administration, is facing when we think about, okay, what does it mean to help people sort of secure a decent quality of life in the United States? But then again, what we found in our research is a really, really devastating scene for a lot of the resettlement agencies across the country, who have long been trying to solve this, this crisis of the gap in funding. So because of, as you know, agency funding is tied to admissions, the gargantuan cuts in admissions have resulted in massive agency struggles. So we found that between the fiscal years of 2017 and 2020, there was an 86% real decline in the number of people arriving. And that is a huge, obviously, decline that was done by the xenophobia of the Trump administration. And since the fiscal year of 2017, we also found that national agencies have closed or zeroed out the budgets of approximately 134 partners, which is a 38% decrease in overall resettlement capacity. So, just to give you a sense, in 2006, a survey found that after 9/11, 58% of resettlement agencies had cut staff, and 25% had lost at least a quarter of their employees. And what we found was that of the agencies that we interviewed, 80% of our respondents lost at least one staff member. And there was really a range of experiences as to what that loss looked like, right? There was some agencies that lost over a quarter, some agencies that lost half of their staff, and one agency in particular lost 13 staff in one day due to a sizable budget deficit inherited from the Obama administration, right? So now that I presented this bleak image of the resettlement, process, now we want to talk about how did resettlement agencies fill the gap that they faced. And for this, I will turn over to Jake, who will share his slides on that.
Thank you, Heba. Let me just get my slides up here. Sorry. Okie dokie. Can everyone see that? Yeah, great. So yeah, thank you, Heba, and thank you also again, Anthony, for putting all this together, and welcoming America for hosting us. So yeah, I'm going to talk a little bit about how agencies in our interview sample kind of work to kind of fill this gap that Heba's kind of outlined for us, and also how they've kind of responded to this period of declining admissions, right, to build a kind of more resilient kind of resettlement infrastructure. Okay. So one of the central ways that resettlement agencies have really tried to kind of fill the gap and become a little bit more resilient is to apply for a whole range of other kind of grants and provide other programs that provide more expansive set of services to refugees. And this is somewhat obvious, right? But it's worth kind of going through. So first and foremost, a lot of resettlement agencies are applying for refugee social support resources and funding to offer services that address barriers to employment. Resettlement agencies are working with NGOs that are also receiving kind of RSS funding to provide similar services. So for example, English classes or behavioral health services. We also found that particularly kind of robust or kind of healthy agencies, I guess you could say, that offer quite a lot of services, apply for funding beyond the federal refugee supports. So for example, Department of Justice funds or Department of Education funds provide the opportunity to do youth programming or after school programming. And this is a really critical way that agencies can fill some of the gaps in federal funding, federal refugee funding. And then also a lot of resettlement agencies that we spoke to drew on resources from states, counties, municipalities, and foundations, and also private donors in their surrounding environment. I should also say that a lot of resettlement agencies have built kind of strategic relationships with employers and landlords to decrease some of the costs and also some of the challenges of finding refugees jobs and housing. And so this allows them to kind of stretch some of the limited resources that they have and hit some of the self-sufficiency targets that they have. And so this often leaves agencies to kind of channel refugees into sectors of the labor market that need workers, right? Or to kind of neighborhoods, apartment complexes that need residents. And so we can talk a little bit about some of these strategies in the Q&A if it's of interest to people. But one thing that we really found in the context of declining admissions is that this process of diversification and increasing programming had become a mechanism of survival, right, under the Trump administration. So this is just some quotes from our data. So here's one. So we were beginning to look for new funding streams before Trump, but now we have to. Another person said it was innovate or die, you know, when Trump came into office. We chose the former, and so we reached out for the first time to a lot of our supporters for help. And another kind of theme that came up quite frequently was that a number of agencies, when Trump was elected, looked at their funding and thought that they were quite diverse and quite able to weather the kind of decrease in numbers that they were expecting, but then soon realized that actually a lot of their funding, a lot of the government support they had, and a lot of the services that they partnered with were actually receiving funds through ORR, so Office of Refugee Resettlement. And these funding sources started to decline, these services started to close down, and there was a lot of fragility in these services. So they had to do something about it. And so given all of this, we found a really kind of significant shift in the funding structure of agencies away from an over-reliance on federal funding to a growing private revenue. And so there's a few kind of interesting strategies that we could highlight here. So one big story is growing engagement with private supporters locally. And so a lot of agencies turn to their community partners for financial support. And in some instances, they did this for the first time. And so one interviewee, for example, told us that they've, and it's a quote here on the screen, developed a network of donors and businesses that support us, which is helping us to find more of that balance where we can say that the community really owns this program. We knew that the survival of our presence in this community was dependent on getting buy-in and funding from the local community. So really kind of bolstering local initiatives to take ownership over resettlement was a kind of strategy that we found a lot of resettlement agencies adopting. Another strategy was kind of more diverse forms of income or revenue generation. So a number of agencies have started really looking at their core competencies around employment entry, language services, legal services, and has started to offer fee-based services to local government agencies and businesses and NGOs. This was a way of kind of diversifying the funding and generating new income and revenue streams. A related example there is that a number of agencies had actually developed kind of retail outlets or retail options. such as online marketplaces or thrift stores. So here's one to your left that Suba will be talking a bit about later on in this talk. And again, just to kind of develop alternative revenue sources. And then a final strategy that we found was resource pooling. So agencies had really started to look kind of strategically at the types of services they had, where they were spending their money, so on HR and other kind of administrative costs, and started pooling some of those, some resources so they could free up administrative money to really focus on their specialized services and direct services. And again, Suba, who's Catholic Charities from Atlanta, will talk a little bit more about that later in the presentation. And it should be noted that a number of agencies had actually started this process of diversification prior to the Trump administration, primarily in response to state-level political dynamics. So a great example, in the Atlanta context, a number of resettlement agencies had developed a contingency plan in the late 2000s in response to the governor of Georgia at the time, kind of threatening to walk away from resettlement or pull out of resettlement. And these kind of contingency plans and diversification strategies that came with them really helped kind of weather the storm of the Trump admin process. I think it's just kind of a lesson to be learned here for resettlement agencies and for the people who support resettlement agencies about really kind of planning for life under different administrations, right? Especially with resettlement becoming increasingly polarized. So before I kind of move on, I just did want to step back a little bit and just remind everybody that resettlement is a federal program, right? And so I think it's easy to, and there's good reason to kind of celebrate these local initiatives, to take ownership of resettlement, to celebrate some of the kind of volunteer initiatives that we're going to talk about in a moment. But it's also really important to keep in our mind that this is a federal program. Resettlement agencies are mandated to execute this federal program, and they're not providing enough resources to do so in many contexts, right? So it's really important to remember this as we talk about some of these strategies that resettlement agencies have been developing. Okay, so another kind of big area that came up in our research is in terms of how resettlement agencies are filling this gap in funding and also responding to the decline in admissions over the Trump period, was a real kind of shift in how resettlement agencies were thinking about their service populations. So a shift from thinking just about servicing refugees to thinking about immigrants more broadly. And there's two kind of primary drivers here. So one was just the kind of undulating numbers and instability, right? So kind of adopting and developing new programming to diversify funds. And a lot of this was focused on servicing asylees and undocumented immigrants, something that oftentimes resettlement agencies have kind of steered away from for a variety of reasons. Also providing legal services, which obviously a lot of resettlement agencies have a lot of competencies within. And also kind of retailoring or reworking their employment and language skills and services and programs to serve other populations. And another big kind of story here really is a shift in the politics of resettlement. And this was kind of interesting during our interviews. So starting with the final years of the Obama administration and a lot of the kind of opposition to Syrian resettlement, the resettlement program really became politicized. So one of the first times in its history. And as a result, agencies, especially agencies with roots in more kind of conservative contexts or communities, have really been forced to take a stand on immigration more broadly, right? In a way that they probably wouldn't have done previously, where they focused mostly on refugees. And so as a result, we had a lot of very interesting conversations with resettlement agencies that have kind of changed the language of their programs, from refugees to refugees and immigrants, or to just immigrants, or even to kind of new Americans. And also, I think this raises some kind of like interesting opportunities for kind of coalition building and advocacy at local levels around immigration issues more broadly. But it does indicate a really potentially quite significant shift in the resettlement sector. And yeah, again, something we can maybe talk about in the Q&A. Another kind of big area was volunteer engagement. And this is something that Leslie is going to talk about a little bit later on in the presentation. But something that came through very prominently in our interviews was that volunteers play a really critical role in filling the gaps that Heba kind of outlined earlier. So volunteers are performing a number of roles, from kind of formalized church groups doing housing setups, interns, AmeriCorps, kind of MSW, Master Social Work students doing kind of admin work or case management, refugee community organizations and doing mentoring and peer mentoring programs, all kind of non-immigrant volunteers, a very kind of range of volunteers doing participating in kind of like family mentor programs, peer programs. And volunteers are really very, very central, as I said, to resettlement work. And yet we really don't kind of talk about them enough, I think, when we kind of think formally about the resettlement system. And I think maybe that's something that really needs to change moving forward, just because of the extent of engagement with volunteers. And maybe also to think a little bit more about the funding structures and supporting volunteer engagement and volunteer coordination programs within resettlement agencies, and also to think a little bit about formalizing, standardizing some of the best practices, and even creating kind of training modules that resettlement agencies can use with their volunteers. And our interviews also revealed a really kind of significant increase of volunteer engagement during the Trump administration. And this reflected, on the one hand, a sizable increase in the number of people stepping forward as volunteers. And so a lot of resettlement agencies actually said that they kind of lacked the kind of capacity to realistically and effectively facilitate the volume of volunteers stepping forward to work in the space of resettlement. And another kind of dimension of it is that resettlement agencies increasingly turn to volunteers to fill gaps in services and programs left by outgoing staff or shuttered programs. And as a result, a number of agencies that actually experienced decline in their staffing and programming in other areas increased their volunteer coordination and engagement, which is kind of an interesting dynamic. And again, Leslie is going to talk a little bit about this later on. So this has already been gestured to a little bit, but a final area that I really wanted to highlight from our data concerns the role of agency staff in building local network and social safety nets around refugees. And this is probably one of the big kind of major takeaways for Heba and I from our research. It's a really critical component of resettlement work is agency staff bringing together a range of kind of disparate actors and resources such as landlords, church groups, community organizations, ethnic community organizations, transportation services, foundations, government agencies, private donors, NGOs, media, and so on, to build these kind of social safety nets and supportive networks around refugees and around resettlement. And in the context of insufficient direct federal funding for resettlement, this is really how agencies can fill the gap, right? Fill the gap in funding shortfalls. And these descriptions of this type of work, this type of bridging and building work, was replete throughout all of our data, and something that was really kind of interesting for us. And so oftentimes people we spoke to use the language of like stitching or braiding or threading or bringing together, weaving together to talk about some of the work that they were doing in this regard. So unfortunately, I can't really provide too many examples of it because of time constraints, but I do want to briefly just reflect on the fact that these networks and these social safety nets are often quite fragile. Right? They require constant work to build and maintain trust, relationships, engagements, enthusiasm, and support. And as a result, the instability of admission numbers and the resultant instability in agency staffing and capacity can really impact these networks and these safety nets with significant implications for resettlement. And this came up time and time again in our interviews. And I think this is one of the big stories really from the Trump period, is that a drop in numbers can really do a lot of damage to these networks and safety nets. And one result is that kind of when we want to ramp up resettlement again, as we're kind of preparing to do now under the Biden administration, doing so requires a lot more than just hiring new staff, right? So relationships need to be reformed and restarted, trust needs to be rebuilt, expertise needs to be redeveloped, and scarce funding needs to be reapplied for and kind of redeployed. And I think it's here that those of you in the audience who are looking to support resettlement, whether from foundations or NGOs or local governments, can really step in. And again, Leslie's going to talk a little bit about this with one of the programs she's been involved with. But something that came through in our interviews was that local government can play a really important role in like building and sustaining networks through facilitating forums and just kind of maintaining relationships between different kind of actors. And also foundations and foundation-funded NGOs can also really support kind of coalition building, advocacy, and can work collectively to organize and coordinate funding and sustain interest around resettlement. And so these types of initiatives and supports can really help build and maintain resilient local resettlement infrastructure, even as we advocate for greater and more kind of stable federal supports for refugees and resettlement. Okay, so that's me and mine and Heba's kind of national project. More than happy to talk more about it, either in the Q&A or over email, so please do get in touch. But I want to turn over to, here's our email, I think it's also in the chat. But yeah, feel free to get in touch. But I wanted to turn over to our two special guests. We have Bahadur Suba, who is a resettlement manager from Catholic Charities in Atlanta. And he's going to talk about a really fascinating initiative called the Welcoming Co-op that has been set up by resettlement agencies in Atlanta to pool resources and resolve housing issues and generate new income. But first, we're going to hear from Leslie Eisenmann, who's the Director of Refugee and Immigrant Services at Jewish Family and Community Services in Pittsburgh. And she's going to talk about 3 programs that she's been involved with. So I'm going to pass it over to you, Leslie. I'll stop sharing my screen. Leslie, are you ready to go?
Okay, no, it said I wasn't allowed to unmute myself.
Oh, I'm sorry.
But now I can. So thank you to Welcoming America, Anthony and Heba and Jake from Boston University, my alma mater. And as Jake said, I'm in Pittsburgh with Jewish Family and Community Services. We've been doing resettlement since we were founded over 80 years ago, but the agency is multifaceted and we have career services, counseling, seniors, guardianship, legal immigration, food pantry, and then my department, Refugee and Immigrant Services. I'm going to talk briefly and quickly about 3 initiatives that I think are important to this discussion, how they came about, what they are, and our challenges and the benefits. So these first 2 came about during the Obama era when our county was so worried about all these people coming into Pittsburgh, which is a relatively small city, after decades in refugee camps and falling through the cracks and ending up on their doorsteps in crisis. And we have an immigrant council, and they did a needs assessment because we have so many existing services. So what's the problem? Why can't we just help people coming in? Well, clearly access due to language and different ways of cultural experiences prevented people from the situations, vulnerable immigrants from using our services. So the county in 2014 put a request for proposals out to provide service coordination to connect refugees and immigrants of any status, of any length of time in the US to existing services and help them navigate when they didn't know how. JFCS went after this and we sought collaborators. We opened it up to any partner that wanted to come in with us. We ended up with 5 partners, and one was a resettlement agency, one was the big English language school, 2 were Latinx providers, and 1 was based in the community. And we got the grant. And it's been an amazing ride the last 7 years. And what we created is called Immigrant Services and Connections, ISAC. You can find it at isaacpittsburgh.org. So all 6 agencies work off the same database. We use the same format. We have service coordinators and navigators. We have many immigrants themselves and refugees themselves as staff. We offer 2 forms of service, like sort of a quickie, we call it IAR, Information Assistance Referral, and then an enrollment into service coordination, which requires an assessment and goal setting. We require that the individuals want this service and that they participate in achieving their goals. Over the years, we're serving several thousand people during the course of the year. We offer services in the field. We set up what we call office hours in different refugee and immigrant neighborhoods where people can stop by with their mail and get help connecting often to legal immigration services, medical access, insurance access, food. Basic needs is the biggest thing, whether it's clothing or medical or food and rent. This is not case management technically, but it gets pretty darn close with the needs that we see. We also provide training to providers, and we work with the existing ethnic community leaders and organizations. So the challenges, we have been in the world of refugees only, and then we broadened to serve immigrants who are not refugees, people without access to services, whether because they don't, for some reason they don't qualify, they could be a legal immigrant and don't qualify, or they're out of status. So it really changed our, we had to learn how to help these families. We ran into families who have more serious problems than you might see in the first couple of years of resettlement, with more problems piled up. Drug and alcohol issues came in, so we had to develop many more resources. And it was hard on staff, and we work with staff a lot to keep their spirits up and to help with what they're exposed to, with a lot more longer term trauma going on. We used to have a tremendous amount of reporting. The county wanted tons of data, and we've tried to streamline that. And also communicating with providers, what is Isaac? And even, the community members, what is Isaac? We don't do your job. Often a provider might hear the accent or hear the name and think, oh, Isaac can do it. Well, we have to remind them, we're referring to you. It's on you to use an interpreter and provide appropriate services. So that's been a learning process that we continue. But what it's brought is this continuum of services. There's no wrong door. You can enter in through any partner. It's central. We run the central intake for people who just respond to our website. It's been stable funding. It's opened up services to people who haven't been able to get them. We've help providers, and we educate the providers. We built metrics early on into how to evaluate the program, and people help together with the service coordinator. Are you in crisis? Are you fragile? Are you safe? Are you vulnerable? Are you stable? And we track them, and we know that they go up 2 points on average through the Isaac program. So that's Isaac. You can check it out again at isaacpittsburgh.org, funded by Allegheny County Department of Human Services, Allegheny DHS. And at the same time in 2014, I'm going to the second program, they saw again this concern for people coming from refugee camps. At that time, that was the worry, and with many, many mental health issues, and what was going to happen to our county if again, we can't serve them. And we developed a pilot with them. It's called Refugee and Immigrant Peer-Led Support Groups. And in that program, we, with all our connections, can reach out and identify leaders in the ethnic communities who have the capacity to facilitate groups. They can recruit, they can organize and lead groups among their community members. We do pay them. That's a very big difference between that and most peer groups. They run for 8 weeks. They can make them look like however they want. You see in the Bhutanese community, a lot of spiritual practices, yoga, meditation, dance. You'll see in the Iraqi group, it's more social. Our Congolese group, they want a lot of outside providers. We also run them in the Latino community, and it's maybe just Spanish speakers. We have a Venezuelan group. We have mixed groups, Latino groups. We also have, Ugandan groups, Korean groups. We have Turkish. And some of these groups have gone on to form a catering business. Some of them have spun off, but they run in 8-week sessions, and they can repeat. And funding wise, it does come from the Allegheny County Department of Human Service. The base funding, a challenge has been getting more funding so we can run more groups. Actually, during COVID, these groups became a way to reach the community, to educate them on COVID-19. And the leaders were deputized as community health deputies. So it was very active. People got devices, and during COVID, it's been essential to reach the community. We also built in evaluation into this program with a professor at a university nearby. And we know, and she's published it in a peer-reviewed journal, that this has helped with connections to their community and knowing about resources. Like I said, some challenges with funding. Sometimes we can't find leaders. Sometimes we can't find participants. But we have been very creative in working around that. And then lastly, this is a very, again, Jake mentioned this, there were more volunteers interested in a way during the Trump era than before, and how to engage them. And we've been doing many things for all along, but something we came up with during COVID is what we're calling Newcomers Crew. We had all these kids, we had many families come right before COVID hit that the kids never went to school. And then we had families that came in the last year and a half. I mean, when the schools went online, it was basically lack of zero school practically with the challenges they were facing. So the Newcomers Crew, we invested in hiring someone to do curriculum, and we found a very vivacious program coordinator. And we created a curriculum that's volunteer driven for kids K to 12. We divided them into 3 cohorts, named them after the 3 rivers of Pittsburgh, and we all online, and each kid had a mentor. We started out with a large group activity and then breakout sessions with the kids and the mentors, giving them suggestions. And every month had a different theme, starting with myself, then my family, then my community, then my world, then my future, and tying lots of activities, guest speakers, creative arts. The goal of that program was English language acquisition and social integration. So it actually fits into the preferred communities framework. And while we did call it a PC group, it didn't have funding from PC, but we did put it into our budget for next year, and hoping if we get the funding that this can roll into PC, since all the kids in this case were refugees and under 5 years. The Newcomers Crew, the mentors, the fact that it was virtual, we had mentors that didn't live in Pittsburgh. The students had graduated and they moved away. We could have people who didn't live, even near the community. So that was a real benefit. The kids, it was fun. We had games, we had prizes, we got donors and again, finding donations was pretty easy for this group, a bag of goodies going to their house constantly. So we knew that attendance would likely be an issue, but we did a lot of reminders. We did have a Swahili interpreter who, because of the majority of the kids were Congolese. And, as we look at the next go round in the fall, we're thinking a hybrid. Most of the kids live in one neighborhood, but not all, and we could transport those kids, but that's going to be a challenge. We've had the mentors have been loving it, and it's been very successful. So another thing, we did do an assessment, a pre-assessment and post-assessment in our first semester, and the kids moved up in reading level by at least a grade. One kid went up 3 grades. So it has already an impact because we're doing, a lot of reading and using books for that. So I rushed through it, and I hope, I can take questions at the end. Thank you for your time.
So fascinating, Leslie. Thank you so much.
Yeah, thank you, Leslie. That was really fascinating. Suba, do you want to share with us a little bit about the welcoming co-op?
Yes, somehow. Can you hear me?
Yeah.
Yes, okay. Good afternoon to everyone. I would like to thank Anthony, Jake, and Heba for inviting us to talk on our experience and what we do in the field site. I'm Bahadur Subba. As I was introduced before, I'm the Resettlement Manager for Catholic Charities Atlanta, one of the 4 resettlement agencies in Metro Atlanta. I'll be talking on the co-op. The co-op was the birth of co-op took place right after Trump administration came in, when many Heba had mentioned about it, and Jake also mentioned about when the previous presidency came in. it was a good learning for me. I had a different notion, but though I'm still working, this is my 13th year with social work as a social worker. I didn't know the reality, but the reality hit me hard. So when the past presidency came in, the reduction in refugee entrance dramatically was cut down, then obviously all the resettlement agency had to find a way to survive, keep on continuing the service they provide to the population that had already arrived. And we did have arrival, but the arrival was so low that it was difficult to sustain. So the co-op, idea of co-op came in. So the co-op, out of the 4 resettlement agencies, Catholic Charities Atlanta, that is where I work, International Rescue Committee, and New American Pathway, the 3 directors of this office came together and started to talk about forming a co-op. And after the discussion, and they thought that, okay, now is the time that we need to bring in staff. So I was involved from my office from the start till now, how the co-op, what the vision was co-op and what needs to be done. So the basic idea of co-op was to prove to the community at large and the federal government that all the resettlement agencies have to provide the same kind of services throughout. So we came together to point out what are the services that we can provide jointly. After the previous administration came in, Trump administration, so when the arrival or the refugee number had been slashed dramatically, obviously most of the staff which work with the refugee resettlement program is tied with the federal funding. When there's no people coming, there's no fund coming, obviously there needs to be staff reduction to make sure that the office keeps on functioning. So luckily we didn't have to leave any of our staff, but we needed to look for avenue how we can be creative to make sure that all the staffs are retained. And being one of the smallest resettlement agency and the blessing of the Bishop's office, we were able to sustain till now. So the co-op functioned like that. So the 4th resettlement agency, which was called Lutheran Services of Georgia, now they are named as Inspirators. They were not incorporated just because their office was in Midtown. And the 3 offices that came together to start the co-op was in the vicinity nearby. Plus, the 3 offices are located near to the service area where most of the refugees and immigrants are placed. So when the co-op started, we decided, okay, during the rounds of meetings, so the meeting started in 2018. It took a long time. By 2019, we got some funding from Foundation of Community Foundation from Georgia, Atlanta, Georgia. So we started a discussion from there. Then after we were determined that the co-op is going to function and certain field and area, we said, okay, the first common thing that we do for all the newcomers is look for housing. Once we have the housing, the moving has to be done. Apartment setup, all the requirement things. And airport pickup is common to everyone. And the supply chain that we had to provide the basic necessities for the new arriving clients. So we discussed on all the topics that was possible that the co-op could help all the 3 resettlement agencies. So the co-op was finally set up and started in November 2019, and we hired our first staff for the co-op on October 2019. Since then, we have been functioning. So when the co-op was founded, obviously we wrote for funding, and Woodrow Foundation gave us the fund for 2 years. The idea of co-op is to make sure that we send a message out to all the community and related funders telling that all the common services that all the resettlement agencies provide together, co-op is going to work for us. We are going to provide another extra services that has to be dealt individually by the resettlement agency or the caseworker that is attached with the resettlement agency. So after that was done, we had to have a meeting to go forward. So now we don't want the co-op to be just for 2 years. So it needs to be continuous, because the co-op has been working perfectly well. They've been helping us with the housing, which is a very good challenge, which I'm going to talk a little bit later. So the idea of co-op is to assist everybody within the members. Then the sustenance was the shop. Now, we receive a lot of donation from our donors. So we have very kind-hearted and helpful community members who donate a lot of stuff. Most of the donated items, we give it directly to the client. And there are some donated items that we cannot use or give it to the client. We either give it to Goodwill or we have to dump it. So the idea of having co-op sustainability and continuation of co-op was to open a thrift store type of store so that community people can come purchase stuff from us. That will be an extra budget that will be sustaining the co-op. So we have just got us this. Hopefully by end of this month, the shop will be ready to function. Initially, we want to make sure that the newcomers access the shop on weekdays and weekends. We want to open to the public so that they can come in and purchase and support the cause that we are doing. That is co-op. Now, co-op is still functioning, and the co-op ends next year, and that is why we are planning to have the shop open by this year, so that by next year we can access how much income we can generate and how much, what is the feasibility of continuing the co-op. Regarding the housing now, right after previous administration came in, the inflow of immigrants became very less. So the movement of the people and obviously the market structure plus now the COVID situation almost for 1.5 years. The movement of clients who are placed in certain apartments in a location has not been moving out as fast as they used to before. So the housing has been a challenge. All the housing apartments that we have partnered with within a specific area. So our center is Clarkston area, which is in DeKalb County. So as everybody might be knowing that Clarkston is termed as the most diverse population in the square mile in US. So when we have new clients, when we try to place them away from Clarkston, they will find a way to come back no matter what. So we just wanted to make sure that they're concentrated. Now we are planning to go out of Clarkston so that they don't feel much far away from the community. So there are a lot of community business, local areas that people can meet. And Clarkston has been a place that people don't want to leave out easily. So the challenge is finding apartment now. So compared to 2 years and now the apartment, the rent has increased by almost 28%. And like all the speakers before have already mentioned, the federal fund, which is called the welcome money, has not increased to match up. So all the refugee service providers need to find a creative way to support the clients to make sure that they are assisted to become self-sufficient, and we assist till that time so that they can carry over and pay all the bills by themselves. So it's a challenge, but there is always activities that each agency has. Each agency has a way of outreaching to their own source of community where they get assistance and unrestricted funds so that that can be used to assist clients to pay the rent and utility till they become self-sufficient. The housing has been a challenge. So I don't know whether other states are facing, but Metro Atlanta, and especially in Georgia, where we are located, the rental, the price of rental has shot up highly, number one. Number two, the availability of housing within the area where we usually place people have not been available. So we are trying to go out. We've been working, and since we are for resettlement agency, since last year, end of last year, we inspirators who were not in the co-op have started to meet with us, and we want to be in the team. It's just because that they were located in Midtown and we are near the clients that we serve where we are placed. So they are moving nearby. So we are trying to incorporate so that all the resettlement agency can be within the co-op. And the shop is one thing that I've already mentioned. So we are keeping our finger crossed that the shop, hopefully the name will be the Shop of Hope, will be full-fledgedly functioning by the end of this month, if not the beginning of next month, and we will be assessing from there. And if there's any question, there are a lot of things, but since I was given an assignment to talk on co-op, that would be my talk, and I'm open for any questions that come after the discussion. Thank you all for listening. I think I forgot to mention that I'm a former refugee myself from Bhutan. I do see one of my community gentlemen in the group and another colleague from Atlanta. So
that sounds great, Suba. Thank you so much. Thank you to Leslie, for sharing all of the information that you both did. I think it really makes an impact to kind of hear what you've gone through in your respective locations there. Heba and Jake, I'd like to move into some Q&A now, if everyone is interested and available to answer some questions. We have had some come through. I want to encourage everyone, if you still got some questions, we have about, let me take a quick look here, about 6 minutes left. And so I say we use as much time as we can and get through some questions here. So keep the chat going. There's been a lot of good engagement going on there. First question I do want to pose to you, and I'm going to pose it to everyone because I think everyone can maybe contribute to this. I'm combining actually a couple of questions on the same topic. And so the question being, as resettlement agencies are moving into new cities and new areas, and then starting to reach out to local supporters, governments, private groups, the question is, how formal should the agreements or even the questions leading into those agreements be in order to make sure that the end result of an effective network of services is attained at that local level? And I'll let whoever is comfortable taking that answer.
I'm sorry, could you repeat the last bit of that question, Anthony? I think I had a glitch from my headphones.
Yeah, so basically just trying to determine in terms of questions and formal agreements between a resettlement agency and local supporters, local governments, how formal should those be, or what types of questions should be engaged to ensure that the end result of that network of services is attained?
So something we, we heard from resettlement agencies, and I don't know, Leslie and Suba, if you have experienced this, but something we heard from resettlement agencies is that there's an issue of sort of the continuation, of projects, right? So there's and this is an issue with development practice in general, which is that, to what extent are we dealing with a sort of a crisis as it's happening? To what extent do we have long-term partnerships with people? So, I'm not sure about the formality of the agreements necessarily, but something that does strike me is that the longer term relationships like the ones Leslie and Suba were describing are probably more conducive to a resettlement agency, particularly under normal circumstances where, okay, I'm going to get X number of people, most likely give or take each year. And so that people can prepare and provide sort of a more holistic service. But in terms of the formality or lack thereof, I think that the issue is not so much the formality, but the sustainability of initiatives and sustainability of help and having people who can sort of be long-term supporters. But I defer to Leslie and Suba, who have this experience, and see what they have to say.
Okay, so I'm unmuted now. So yeah, well, in Pittsburgh, we are ripe for resettlement. Our population is half of what it used to be. So there is a need for people. There's not enough people here, good people, productive people. So our local government has been very supportive of new people coming. But as Bahadur said, housing, they can't change that for us. So that is what everyone's asking, housing. We have tons of jobs, entry level. Again, if for people with English and high skills, it's an issue, it's a process, but we also have lots of programs to help with that. I'm very cognizant of the people in need who grew up in Pittsburgh. We want to work with them. We don't want to step over them. And we do a lot. I mean, I did, especially during the Obama years, I did tons of outreach, which isn't even really paid for by anything. With the doctors, with the medical, with the schools, with the welfare department, with the transportation department around state IDs, everything, housing, neighbors. I mean, everyone's going to be, they see people who look different walking around, not knowing where they're going. People speak up sometimes, and you have to do a ton of outreach. Welcoming America, that's their space. And all those dialogues and things are really, really needed.
The issue of housing is really resonating in the chat. Miguel in Buffalo said, housing has been an issue. I know I saw other comments about housing also come up in the chat as a real systemic issue across place.
Well, something that's definitely trending now is this community sponsorship form of resettlement, where community groups will help financially with, several months of rent on top of what they get. And then landlords might be willing. We think if we can get 5 months of rent, that could change the story, we think. But right now, we guarantee 2 months plus security deposit. And if I go on match grant, that's an extra 2 months, but we don't sign the lease. But if we could get more rent that we can guarantee, that would help.
Yeah, and just to riff off of that, the community sponsorship thing was something that you had also said, Anthony, did you want to ask that question, or should we just continue to speak on that?
Yeah, no, I was just going to say, that's a great segue into another question. And yeah, so we had that question actually come in as part of registration. So I don't know if, everyone wants to elaborate a little bit or share some other examples around community sponsorship, because that was what someone was looking for. Before we do that, though, I just want to point out we are at the top of the hour, but these are great conversations. So if all of our speakers are willing to, we'll stay on for a few more minutes. If anyone does need to drop, completely understand. Again, this is being recorded, so you'll be able to get access to it and listen to the full conversation. So again, with that, does anyone have any other elaborations or thoughts around some best practices around community sponsorship?
I'd be happy to chime in on this, because this is something I looked at, because I was also looking at community sponsorship in Canada, where that's a primary sort of mode of resettlement, and then was looking at it in the United States, where I was doing my field research, which was in New Haven, Connecticut, with a resettlement agency called IRIS, which has a big and expanding community sponsorship program. And something that, to Leslie's point, something that I saw was that community sponsorship can be super important, because we have this dearth of support, particularly around rent. But, and so there's rent, there's something else people brought up in the chat, which is the importance of social capital, having those connections to find jobs, having the connections to learn English. So that can be a really important facet of resettlement. But you know, because our social service system is so depleted in the United States, right, there are some issues that are posed with community sponsorship. And for my work, I saw two main ones. One is, you know, turning something from an entitlement to a charitable relationship. So that can be really hard for people who have been super independent for really long periods of time, and then to have to rely on another family or other individuals rather than it being sort of a state benefit. So that could be sort of, you know, hurting people's agency or hurting people's sense of you know, space or sense of independence. And the other thing that I saw was that, you know, unfortunately, because the social welfare system is so complicated, you really need experts to get people the kinds of services that they need to access. And community sponsors often do not have that kind of expertise. So you actually have to sometimes do more work on the level of the agency to be able to provide those services, you know, for the family. So you know, what I'm saying is that it can't be outsourced completely, the work of resettlement, just because of how complicated it is. So, you know, so I think that I agree that it's really interesting, and that's, you know, a little bit of a caveat that I had, or something that I observed with community sponsorship. But again, I defer to other folks on here who have also worked on it, you know, themselves.
If I can just chip in something, I think that I, as an individual, want to see different perspectives. So obviously, when the Trump administration came in, there was reduction of refugee entrants, and obviously before Trump, the arrival was so high that we were busy just receiving the client, providing the services, and it's a continuous cycle. But I think it gave us a time to step back and think, what are the things that we can do and provide the same kind of services that we had already received for clients that are here. So I think we found we could reach out to more community and local funders during this span to get extra help through different grant writing. But obviously, the good thing is in our office, we have a department which is headed by one of our staff who are just geared for grant writing. So I know that those staffs were messed up. They were writing day and night, but that brought us an avenue to look for newer avenues where we can go locally, not only dependent on the federal fund to provide services. So I think that if I see the positive side of what happened, yeah, negative side may outweigh the positive, but there's positive side also. We were able to find opportunities and find ways and loopholes where we have never checked before to get local funding. So I personally think that as an individual, for me, now we know that anything happens, there are ways that we can get funding and assist the client. It is, I think, primarily what we are here for is to provide services to the clients who are in need and guide them. So I think those are things that I feel that personally it is there. And as I'm speaking, I see a question here for Ms. Leslie and me, and I'm taking the liberty to answer that question. It says that, are we going to hire in full capacity since Biden came in and increased the ceiling? I think most of the participants here, if you are working with the refugee resettlement direct service provider, then you might have got update from your head office or your directors or up branch that the number that was the ceiling that was set for this fiscal year is not materializing because so many reasons. One of the things is COVID. So we are not going to have that number of 65,000, which was reduced, changed to 45,000. And obviously we're going to receive more than what was made ceiling in the last, before Trump era. So anticipating of 2022 ceiling that had been placed 110 or 120,000, we are slowly working. I think each resettlement agency is working individually with their head office to make sure how to plan when arrival picks up, to make sure that we have enough staff to support the new arrival client with the arrival. So In our office, we are doing a lot of creativity things that we are hiring part-time staff right now, train them. And as and when the arrival increases, we want to bump them into full-time. So that way there's a transit and we don't have to worry much about training because this is a training period. So we are hiring few part-time staff. As of now, I think 2 or 3 have already started and we're still working on 2 or 3 of them to make sure that each department have a part-time staff as of now. So we have a year to train them. And when the arrival picks up, finger crossed, if the arrival picks up as it needs to be, then those staffs are well trained enough to take up the full responsibility and become a full-time staff. So if I've answered your question, I don't know, Ms. Leslie, what your agency is trying, but that is what we are doing here.
Similar. I mean, one thing I can say is when arrivals were low, some of those staff went into Isaac and helped. So they could, we didn't have to lay off we had maybe 1 or 2, but compared to what we would have had, we were able to sustain people through Isaac. And then the challenge with RMP, when people come, it's all hands on deck. So then Isaac loses somebody and that causes problems. So we were just pushing people all over the place, getting an extra money a little bit here, and we diverted them. So people had to be very flexible and do things maybe they hadn't intended. And we're hoping, we don't want to hire before we know, going part-time, using interns. We haven't used volunteers actually for the core. Interns, yes, but that will change if, assuming we start this community sponsorship, which I understand you don't really save in staff. It just diverts to more community management, the volunteer management.
I think I can just back up Ms. Leslie and just add that, in our agency also, we have different departments. We have the immigration department, then the after school, then the housing departments are there. So when we had a crunch of sustenance, then we moved our staff around to another department so that at least they have a job and they're not laid off. That is one thing. So, and we are blessed to have year-long JV volunteers, Jesuit volunteers, that when they come here, then I usually take up I like to train them because I'll be supervising them, and they work as a full caseworker. But it helps to reduce the load for the full-time staff, which are quite less right now. So I think, and thank you very much for whoever has mentioned about the welcome money. Hold on, that was called welcome money and RNP fund. So this is something that we have been talking a lot of time. So this was initially 2008 is when the Buddhist refugee the first Buddhist refugee was accepted in US. Luckily, I was here before the refugee came. Had I known it that we are going to come as refugee, I would have waited to come as refugee, but somehow I made 2.5 years before then. And so I'm asylee, but lived in refugee camp for 13 years before I came to this country. So we had orientation from the State Department in Georgia. So we were a handful of Buddhists here who were told, and because they wanted to know what are the cultural appropriate clothing, fooding, all the stuff that had to go. And they said, okay, welcome money. So we still have Buddhist people. Now we don't have Buddhist arrival because the cap is done, cap is sealed, but we still hear people talking about welcome money. So we should not be referring that money as welcome money, because people have a different notion that when they have cultural orientation before they fly to this country, they were told you will have welcome money. That welcome money is RNP fund. So we just need to be sure that during the first intake, we explain to the clients, no matter what, if they understood or not, it is our job, our caseworker staff tell them that your RNP fund is also called welcome money. It's the same. There's no extra money as welcome money lying somewhere for you guys. So I think we need to be straightforward. I think that. Thank you very much for saying. I might have misquoted as welcome money when I referred that the rent is going up, or the cost of living is going up, but the RSP fund is according to meeting. So I'm thankful actually when the first Buddhist came, when I first started to work for International Rescue Committee in 2008, the RNP fund for each person was 425. That is when most of the people came. And after I don't know how many years, in 2012, they made to 925. So it was almost after 20 or 25 years, they increased to 925. And before COVID started, right before COVID started, and they increased to $950. So, but the inflation rate and everything doesn't match with whatever is increased, but it is an increase. That's what I'll say. It's obvious.
Yeah, this is so. Sorry, I didn't mean to interrupt you, but that's so fascinating because I also spoke to somebody at the federal level who had said that there was only, you know, initially it was just one bulk and then there wasn't even any funding for the resettlement agencies outside of it. So that's a really important point. And I do appreciate the sort of caution about the use of welcome money. You know, it is the term that is sort of officially used, but I do agree that, you know, there is a sort of danger to the use of that term. And so I really appreciate that. And I really appreciate, you know, your reflection, Suba, as somebody who experienced it from sort of both sides, you know, and also as you know, from your role as a social worker. I think that Anthony actually wanted to wrap us up as we're approaching sort of 15 minutes after the hour. So I'm going to turn it over to Anthony. And again, I want to thank Jake, I want to thank Leslie, and I want to thank Suba. And guys, this is not, you know, this is the beginning of a conversation. It's not the end of a conversation. So you should feel free to reach out to us and, you know, reach out to Anthony. And we also can connect you to Leslie or to Suba. And so I really appreciate this opportunity to create connections, you know, and we really appreciate you all being here and staying even 15 minutes post the hour. Anthony, you want to take it away? You're muted, hon.
I always forget that. No, I was just saying, I want to thank all four of you so much for this, and Heba and Jake especially for coordinating last week's and this. Again, we've had so many individuals that were excited about this topic of resettlement. And I appreciate you saying that this is not the end of this. This is going to be something that will continue to be discussed. And I hope we can bring you all back to continue this discussion. I think this has been really something and look forward to keeping it going. So again, thank you all so much for this. As we start to kind of wrap it up here, just a quick reminder to everyone, as I said, all of this is recorded. We're going to share it out with you in the coming days, along with the recording of last week's presentation. So if you did not get to partake in that or get to listen to it, you're going to see how both of these really complement each other and build on each other. So I definitely encourage you to do that. Just really quickly too, oh, missed that one. I do want to point out, some of you may be aware of this, but we at Welcoming America have a really big event coming up later this year in September. It's Welcoming Week, and some of you are probably already thinking about it. Some of you have participated in this in the past. If you haven't, this is really a week for us where we see events happening across the country, across the globe, that really promote belonging, inclusion, and welcoming for everyone. It's a very inspirational and educational week. And if you're interested in learning more about it, we are going to be holding a launch webinar for 2021 Welcoming Week on June the 17th at 2 o'clock Eastern. So as part of the follow-up email that I'll send out, I'm going to include the link to register for that in case anyone is interested in participating or learning more. So we'd love to have you participate with that. Again, if you don't already do so, we encourage you to follow us on all the social channels that you see here on the screen. You can also subscribe to our monthly newsletter on our website. So we encourage you to do that as well. Thank you all for hanging in. To those of you that are still here, we appreciate it. We know, again, we've gone a little bit over, but this was such an important conversation. I wanted to make sure we kept that going. I appreciate, again, all of our speakers, all of you for joining. Have a great rest of your day and a good week, and we will see you soon. Take care, everyone.